Hi there. So what I'm going to be showing you now is a couple of different assessments that we do on our newborn. As soon as the newborn is delivered, the nurse is going to check them out. They will suction out their mouth. Then they go down, after they've warmed up a little, they usually go down to the nursery. And what I want to show you is how to do a head circumference, a chest circumference, and an abdominal circumference on a newborn. Another thing I want to show you is apgar, A-P-G-A-R, scoring. Now I have this sheet sitting here for you. You will all have it also in your notes. We do the apgar scoring on infants immediately after delivery, and that's very, very important. And then we do it at 5 minutes and we do it at 10 minutes. Usually by 10 minutes, the most they can get with an apgar score is 10 points. So usually by 10 minutes, we want them up near 10 points. So some of the things that we look at: activity. Is there muscle tone? So first off, I'm getting ahead of myself. First off, I'm going to, of course, wash my hands, identify my patient. So here we'll have an identification on the crib. That helps, but they also have the name band. So I'm going to unwrap my little baby. Now I want to try to keep them as warm as possible, so I don't want to unwrap them all the way. So checking, oh yeah, look at this name band. This is Baby Smith. Here's the name band I'm looking at. So I know this is Baby Smith. So then to do apgar, first off, muscle tone. Now if I pick this up and drop it and they just drop, that's absent. But if they're flexed, see here how the legs are flexed a little, they're not just straight and hanging, they're flexed, that's good. That's what we want to see. And do they move actively or not? So we can either give them 0 points for no muscle tone, 1 point if the arms and legs are flexed but not moving, and 2 points if they're moving. Now, we also have to assess a fetal heart rate. So, here is my stethoscope. If you are in the nursery, they will have newborn stethoscopes, and they're only this big, which is awesome. Now, because I have not got a newborn, I am going to use my smaller one. If I use my bigger one, I am going to be covering too large of an area on my baby. So I'm cleaning off my stethoscope before I even get near my baby. I've done WIPSA, by the way. So I'm going to come in and I'm going to assess fetal heart rate, which is right between the nipple line. Here is the nipple on my infant. I'm going to place this right between, and I am going to listen for a full 60 seconds. Now, do not have your thumb on top. You know that's not good. The best thing is like this, and hold it and count. Now we want it above 100 beats per minute. If you're not hearing any at all, that's 0 points, absent pulse. If it is below 100 beats per minute, we give them 1 point. And if it is over 100 beats a minute, we can score them as 2 points on our apgar score. Now, next, after I've done that, I have to check their reflex irritability. So again, are they flaccid? There is just nothing. They flop. There is nothing. Or if I irritate the bottom of their foot, do they try to flex their extremities away from me? Even just a little would be a 1 point. And then if there's active motion, again, if they're moving, if they're coughing, if they're pulling away when I do this, because babies they'll jerk right back away from this because it's irritating. That would be a 2 points. Then we have to look at appearance, which is the color of the baby. So now you have to uncover them and look. What you're looking for, are they totally blue and pale? That's not good. That means our baby's not doing well at all. 0 points. Now, maybe the body itself is pretty pink, but I might see a little circumoral cyanosis, so circumoral around the lips. I might see the extremities, the hands and the lower part of the arms, a little bluish. So I would look, and if I do see that, that's really quite normal, but we only score them at a 1. And then if they're completely pink all over, we give them a 2. Wonderful. I'm going to cover my baby back up because I don't want him to get cold and go into cold stress. So now respirations are the last thing we look at for apgar scoring. Are they breathing? Now, do not look at the chest. Infants are not chest breathers. They breathe through their abdominal muscles. So you have to look at below the rib cage at the abdominal muscles and watch them for the rise and fall to let you know that they are breathing. If you see none, it's absent, 0 points. If it's slow but irregular, so if it's below 20, then it's only 1 point. If they've got a vigorous cry and their respirations are going along with that cry, very, very vigorous, very loud, that's 2 points. So that's wonderful. So now on the bottom of our sheet, we can see this. It tells us that if the patient or the baby scores 0 to 3, it's severely depressed. Moderate depressed is 4 to 6, and their excellent condition is 7 to 10. So a total of 10 maximum points, and that's really what we want to see them at. So keep that in mind. The next thing I want to show you is how to do the head assessment. I have to get my little tape here. Now my tape is both centimeters and inches. I'm hoping you all realize by now that we measure in centimeters. So for a head circumference, I'm going to take this little warming hat off, and you want to measure right here at the brows and just above the ears. So I'm going to slide this under very gently. Make sure it's pretty straight right at the brow and bring it down. Run it by both ears, right across the top of the brow. Don't pull it tight, just gently. And this baby is at 37. Perfect, 37 centimeters. I like that. So I'm going to take this off. I'm going to put my little warmer hat back on for this one. And now I have to do a chest circumference. Chest circumference is done right at the nipple line and right under the axilla. So very carefully, I'm going to move my baby over. I'm going to slide this under, right under the axilla. And, oh geez, right above the nipple line. My tape broke. Did anyone see that? Well, we'll just simulate this. So very easy. I'm going to bring it over. This baby's chest circumference is 39. Wonderful. Okay, so then I'm going to, actually at this point, I would slide it down to do my abdominal circumference. And I'm still using my broken tape. Here's our umbilical cord. It's not clamped. On a regular baby after delivery, they're typically clamped. So, okay. So I've got to get my tape, slide down so it's not up at all on the back, right across the umbilicus. This is going to be flat. Just a minute. You know how well I can put things together. Let's do this again. Here we go. So this baby's abdominal circumference is 39.5. Right here at the half mark. So 39.5 centimeters. All of these measurements are centimeters. All right, that's the end. Enjoy.